Welcome back to Neurodegeneration Awareness and Artificial Intelligence. I'm your host, Dr. Sukant Khurana. Today, we turn our attention to region of immense cultural diversity and rapidly evolving healthcare landscapes, that is South Asia. In fact, people on this call have been born in South Asia, in India. We'll discuss broader South Asia, which includes Afghanistan, Pakistan, India, Nepal, Bhutan, Bangladesh, Myanmar, Maldives, Sri Lanka. So we'll cover the subcontinent. Broadly, whatever is said about one is broadly relevant to another, right? We have with us Kanak Chaudhary. She is a researcher interested in neurodegeneration. She is a cell and molecular biologist. We will be together piecing together the story of South Asia. Welcome, Kanak, to the show.
Thank you, Dr. Sukant. It's a vital discussion for a region with a significant and growing population.
Indeed, Kanak. When we consider neurodegenerative conditions like Alzheimer's and Parkinson's in South Asia, what are some of the primary factors shaping public awareness and understanding?
Yes, so several interconnected factors come into play. Like, firstly, in many parts of South Asia, there's still a relatively lower level of general awareness about these specific conditions compared to, say, some Western countries. And cognitive decline is often seen as an inevitable part of aging, leading to under-reporting and delayed diagnosis. Secondly, significant cultural stigma surrounds mental health and cognitive issues, which can prevent families from openly discussing or seeking help for affected individuals. Also, varying levels of health literacy across different socio-economic strata and rural-urban divides contribute to disparities in understandings.
That is very true. So, whether you are in India, in New Delhi, within New Delhi, whether you are in some other richer parts or you are in slums, makes a massive difference. Whether you're in New Delhi versus Kohima, big difference, or you are in a village in Uttar Pradesh, massive difference within a same country. Across countries, differences are even more where there is strife. Some parts of India, almost all of Pakistan is currently in strife. Afghanistan, these kind of very serious issues unfortunately take a back seat, right? And rural urban divide is there, socioeconomic strata is there, regional disparities are there. So you mentioned it very correctly. The cultural stigma that you mentioned presents a significant barrier across board in South Asia. How does this manifest and what are the consequences for individuals and families?
So, this stigma can manifest in various ways, from families feeling shame or I can say embarrassment to outright denial of symptoms. It can lead to social isolation for both the person with the condition and their caregivers. And the families might try to manage the situation privately, delaying or avoiding thus seeking medical advice, which can hinder access to early interventions and support. In some communities, there might also be misconceptions or even spiritual explanations attributed to cognitive decline, further complicating the path to appropriate care.
That is true, actually. So there is a lot of social isolation for people in old age, which is not discussed because society has moved towards nuclear family by and large in urban areas. In rural, that's also happening, but we still pretend to be having a joint family in Indian subcontinent and South Asia. So there are a lot of issues. People try to hide this situation, and there are even a lot of beliefs that there is a ghost, there is bad spirit, there is bad omen. So there are various things, and there are common sporadically across South Asia. So it's a rather multitude of problems, and there are multiple layers to it. But let's discuss healthcare infrastructure, right? Among this, all these problems across South Asia, it's vast and diverse region. What are some of the common challenges in providing care for neurodegenerative diseases?
You are right, it's incredibly diverse. And however, some common challenges includes limited access to specialized neurologists and uh, geriatricians, particularly in rural areas, and diagnostic facilities, including advanced imaging and cognitive testing centers, are often concentrated in urban centers, creating significant geographical disparities. Furthermore, the sheer volume of the population puts immense pressure on existing healthcare systems, often leaving chronic conditions like neurodegeneration less prioritized than acute illnesses.
That is true. Now, there are even other issues of what is there in government hospital, what is there in individual small clinics versus large private hospitals with overemphasis on testing, um, physicians' willingness or unwillingness to go beyond the protocol. So the corporatization of medical healthcare system is one aspect of large hospitals. There are still some brilliant individual practitioners. There is a lot of brain drain of top physicians from India. In fact, just a few days back, one of my cousins migrated out, and having seen what I faced in academia, it's not a surprise. Then there is aspects of government hospitals which are overburdened, but there are some elite government hospitals. And the situation is similar whether you go to Pakistan, Bangladesh, Sri Lanka, Maldives, Myanmar. It's identical situation. You can see across the street two very different experiences in Nepal and Kathmandu itself. So it's a very interesting and diverse space, and it's a very challenging space. Interesting, not in a necessarily in a good way. So, but now let's look at other aspect. How does the funding landscape for neurodegenerative care look across the region?
So, the public health spending on chronic neurological conditions is generally low in many South Asian countries. The burden of care often falls heavily on families with limited government support or comprehensive insurance coverage for long term care. Also, the out of pocket expenses can be catastrophic for many households, further exacerbating the existing socio-economic inequalities in access to the care.
That is true. See, even if you are going to a government hospital, on paper things are free, and there have been some significant wins. I mean, in fact, even in India, there are counts on which the current government, central government, may not appear a winner, and there are counts on public health where both central government and various state governments have done wonderful things. So, in some ways, ruling parties, opposition, region wise across India, there is access to public health care which is expanding, both due to regional state government initiatives, various state government and central government. And in fact, it's become a competition of sorts. One can discuss the taxpayer burden of it, whether it's justified, whether it's all spent well or not. But despite that, there still remains some very interesting challenges that you go to hospital, doctor doesn't charge you any fees, there is none, but there are only some medicines you can get. Now, let's say if you're getting something of L-DOPA and they're not available for Parkinson's in a government hospital, buying them from a chemist, if there is an auto driver, there is a vegetable vendor, there is a small shopkeeper, there could even be a skilled technical worker, right? Someone, a locksmith. They simply can't afford it. Even for a middle class, school teachers make, you know, laughably small amount, rather pitiable amount, and it can completely destroy their lives. So I think you made a right point that this can exacerbate existing socioeconomic inequalities, which are one of the world's worst in South Asia. I'm using India as example simply because I'm currently sitting in New Delhi. But now let's look at these significant challenges. Given these challenges, how do you see AI, artificial intelligence, potentially playing a positive role? How can it improve neurodegeneration awareness and care in South Asia?
So AI offers a unique opportunity to leapfrog from like some of the existing infrastructure limitations. And for instance, AI powered tools could be developed for remote screening and early detection of cognitive impairment, accessible even in areas with limited specialist presence. Also, natural language processing could analyze local languages and dialects to create culturally sensitive awareness campaigns and educational materials delivered through mobile platforms, which have a high penetration rate in many South Asian countries.
It's a fascinating idea. I fully subscribe to it. In fact, at IonCure, we have worked on several things and will be releasing. There are some other challenges, though. The problem with awareness is there is no money model. Government funds academia, which funds itself, people who belong to certain academic gangs. It's sort of a rather incestuous system. Startups get funded often who bribe people, or there is a direct money model, right? NGO ecosystem is again, you scratch my back, I scratch your back kind of model. So I see vexed problems. It will take a serious philanthropy, or you can say daring stupidity, which I've been guilty of, to break through this. And the way to achieve it, what you've rightly said, is AI can fundamentally approach the problem that India has, not 100, definitely not dozen or three or four. India actually has thousands of dialects. Even officially recognized, we have more than 30 languages, but that's really tip of the iceberg. For example, if you say there is a language called Nagamese in Nagaland, across 11, 12 valleys within a small state, Nagaland of Northeast India, what one valley people are speaking is incomprehensible to the next valley. Synthesis, an artificial construct of putting together a language, right? Within what we call Hindi, we're talking of hundreds of dialects, which together constitute what has become a standard Hindi, and that too has evolved. If you look at movies which were just at the end of silent era when things started coming on TV, look at radio versus look at now, coming in, influx, and then sort of efflux over the words. So it has same has happened. So if you think of Punjabi, you may think there is one language, and most people sitting in Delhi don't realize how many dialects are there. So it's rather complicated. So this is where AI can break through and communicate with the last person, which is the challenge. I would still think the funding remains a challenge, support remains a challenge, because frankly, if someone said that, hey, you're a smart guy, would you like to make money, or versus would you like to give 20 years in solving a problem, most people will prefer getting money, and the money is not there. So there is a challenge out there. And the funding is for labs where people buy instrument, there are kickbacks, a rotten academic system, which I can discuss some other time. But, there is hope. It's not hopeless. And that's why I think AI can be the savior that South Asia, not just India, Pakistan, Sri Lanka, Bangladesh, Nepal, Bhutan, Myanmar, Afghanistan, Maldives, all these countries need. AI can be that, given the linguistic diversity is in thousands, and multimodal communication. So it's a huge, fascinating idea, leveraging mobile technology and local languages. Now, can AI also, let's pivot to something else, Kanak, could AI also assist in bridging the specialist gap?
Absolutely, sir. So, AI driven diagnostic support systems could assist general practitioners in identifying potential cases that requires referral to specialists. And telemedicine, and if I say that telemedicine platforms enhanced with AI could facilitate virtual consultations with neurologists in urban centers for patients in remote areas. Also, AI could aid in analyzing medical images and other diagnostic data, potentially speeding up the diagnostic process where specialist expertise is limited.
Yeah, that's true. So data availability is another challenge. I can comment on what you just said. I'll use example of cancer detection with centers being in Bangalore, ASHA workers working through even cameras mounted on drones. So mobile phones in hands of ASHA workers, right, and even in getting support from families, there can be a lot that can come into the play. So there is huge possibility of what can be done with AI technology, right? In terms of reaching the last person in diagnostic, monitoring the progression. Um, my concern is there's still too many agencies. I think something good that has been done by the current government in India. There have been similar efforts in Pakistan, which lags behind India. Bangladesh was going in the right direction, and then there's been government instability and all. Broadly, instead of funding through 20-headed monsters with vested interest, more centralized funding solutions are needed. And what has happened in all of this is there is the weakening of WHO with US walking out and weakening of international bodies, and also genuine bias, right? People like me who are not necessarily on the left end of spectrum will see very clear bias of people who run even these international bodies. And then there is problem not just at the left and at right end of politics globally and India level. Um, so it's a rather vexed situation with confounding interests. So it's not easy, but I think definitely AI can make a difference even at the second thing. First thing we discussed was language, right? Second thing is specialist gap. You mentioned something where at present AI can help bridge the gap. Later, AI could itself be the doctor, which raises a lot of ethical questions and all. But I think progression of neurodegeneration, that monitoring can be done through AI. Now let's come to another challenge. Garbage in, garbage out. Your AI is as good as the data, right? It's trained on. Obviously, the models matter. So data availability and quality can be challenged in many regions. How might AI contribute to improving data collection and research in neurodegeneration within South Asia?
AI can play a crucial role in extracting and structuring information from diverse and often unstructured medical records. Also, the natural language processing can help analyze clinical notes and patient histories to build more comprehensive data sets for research. And AI powered tools can also facilitate large scale epidemiological studies to better understand and prevalence uh, and pattern of neurodegenerative diseases across different populations within South Asia.
Well, those are there. There are ethical considerations, but I'll skip the ethical considerations which are coming to my mind so that we don't drag it on. And we've already discussed some of the things of policymakers, which right now can be, a lot of hand waving because it's not in our control. I tend to lean more towards what private sector can do, what entrepreneurs can do. And the biggest challenge I see currently is linking profits to delivery, because without profits, you're bound to the grant model, which is not sustainable in the long run. Kanak, this has been very insightful discussion coming from someone like you who's very young and is focused only on the science part, and someone like me who's jaded, who's seen horrible politics, who's also seen entrepreneurship successes, failures, challenges, and is looking at sort of the scaling up of a solution. So it's been sort of a very interesting discussion. So it's broadly a very hopeful message, right? If we cut across all the noise between my messages, your messages have been always hopeful. I've presented both the hopeful as well as the gloom and doom scenario. But what you have said to me is a powerful and hopeful message. Kanak, thank you very much for being with me today. Thank you.